Hi, and welcome to Fairview Range Focus. I'm David Hall, Chief Administrative Officer for Fairview Range. We have a really special program for you today, so I'm excited to be able to share this with you. Today we're filming at Fairview Range Medical Center and the Breast Center. So we're excited to be able to show you some new technology. We have some very special guests. And as October is Breast Cancer Awareness Month, we thought very appropriate to talk about breast cancer and the Breast Cancer Center. And some new technology that we have available that we're real excited about that is very high tech, and you'll learn more about that. So I'd like to welcome our guests today. We have Dawn Hayes, who is an RN and a breast navigator, and we'll hear more about that, and Dr. Sandra Hanson, a general surgeon with Fairview Range and who has specialized in surgical management of breast disease for over her 30-year career. A little bit later in the program, we're going to be joined by Dr. Frank Suslavich, who's a radiologist here, who's going to talk to us a lot about some of the new technology that's available here with mammography. So thanks for joining me, and let's start. Dawn, I have heard about nurse navigators, and as I understand, that's what you do.
Yep.
So maybe tell us a little bit about that role and what you do at the Breast Center.
Okay. Well, here in the Breast Center, I'm an RN, and I get to take patients from their initial mammograms through obtaining their results, and then we follow the radiologist recommendations based on the interpretation of the studies, and we coordinate evaluation with the breast surgeon. Dr. Hanson and I get to work together to facilitate rapid evaluation of those findings that we find on the radiologic studies, and my role is to expedite the evaluations and participate in the post-biopsy care and follow up with these patients. I get to help breast cancer patients transition from diagnosis to treatment, helping to reduce the patients and their family's stress as well. And I get to provide personalized service based on each person's needs and ensure that all tests and images are scheduled in a timely manner and that the patient has the information and the education that they need every step of the way.
That's all you do? That sounds like a lot. I know, I've heard from other people that as a navigator within the system, you really help to be able to, as you said, expedite things, make connections. Have you found that to be a really valuable treatment or help for the patients? Does that make a lot of difference for them?
Mm-hmm. The best part about my job is I get uninterrupted time with my patients. From the time that they come to me for, say, a biopsy till the time that they leave. I don't get pulled in 5 different directions, and I get to make the personal connection with them so they feel less nervous while they're here for a biopsy. And then hopefully when they go home, they're a little bit less nervous when they're waiting for their results.
So you kind of become their main contact then?
Mm-hmm, yep.
As they're going through the process?
If they have questions and if I can't answer them, I can talk with Dr. Hanson or a radiologist or their primary care provider to find them what they need.
Oh, wonderful. Great. Sounds like a really important role.
It's
Great.
Wonderful. Mm-hmm.
So how about the services of the Breast Center? Can you tell us a little bit about what kind of services that you offer here?
Yep. We offer traditional digital mammography. We do give results before you leave with that. We are introducing 3D mammography, which is a brand new service for us. Something important for patients to know is this isn't covered by all insurances, so we urge our patients to call their insurance companies to find out if it's covered for them. If it's not covered by their insurance agency, the out-of-pocket cost is less than $100 plus the radiology reading fee, and they've always charged a reading fee. We also offer breast ultrasounds, and we do advanced breast imaging like breast MRIs. And we frequently do breast biopsies with radiologic imaging as well. And then I also do clinical breast exams.
Okay. You mentioned about the same day feedback to the patients. Mm-hmm. Can you touch on that again? I just really want to emphasize it because I know from my own wife's personal experience, that's a huge thing of being able to get results right away. Can you describe that again? So
if a woman chooses the traditional mammogram, the 2-dimensional mammogram, we give results before they leave. So if they need to have additional pictures or a diagnostic mammogram, we're able to do that usually right then and there for them. And then if they were needing an ultrasound after that, we'd be able to do that right then and there for them as well. And then if the patient had further needs as far as biopsy, I'm able to do education with them right there and then coordinate with Dr. Hanson after they leave and work behind the scenes to make sure that everything falls into place in a timely manner. With our new 3D mammograms, we're calling people the same day with their results.
Okay.
And we'll get more into why that is
Okay.
when we talk with Dr. Suslavich.
Great, good. Well, that makes a huge difference. It seemed like it was, I don't know if years ago, but some time ago when someone might have an exam like that and have to go home and wait.
Yep,
So
and that's a lot of stress and worry for the women.
I agree. Like I said, personal experience, I know that's to be the case as well. So good, thank you. So Dr. Hanson, I know that you have a lot of experience in surgical services and breast disease management. Can you tell us a little bit about that? I think people would be really interested in a little bit about your background.
Sure, David. I graduated from the University of Minnesota Medical School at a time when there were very few women in general surgery. So when I opened my practice in Duluth in 1986, my office was filled with women with breast issues, breast disease, and breast problems because they felt most comfortable having a woman deal with it. So over the years, the percentage of my practice was heavily weighted to females with breast issues. So by 1991, I was 90% breast. The American Society of Breast Cancer Surgeons began in the early 90s, and I was one of the charter members of that organization as well. So over the years, I have done a preponderance of breast disease and participated in the evolution of management of breast cancer detection, diagnosis, and treatment, as well as prevention.
Oh, that's wonderful. We're very fortunate to have you here on our staff, I know.
I'm quite excited about this new technology. The 3D mammography allows us to detect malignancies at an earlier stage. It reduces the callback for negative findings and inappropriate biopsies, so it is a major advance in breast imaging in the Hibbing region.
Wonderful. Well, I'm excited to hear more about that. I know one of the things we wanted to talk about was guidelines in regards to the breast cancer screening. Can you speak to what's current in that regard?
Sure. We follow the National Comprehensive Cancer Network guidelines for screening mammography. Screening for breast cancer includes not only the mammographic imaging, but professional breast examination. So remember, when we're talking today about mammography, we're also stressing the fact that you need yearly breast exams. And this starts at age 40 for the average risk woman. There are those women that are at higher risk, and we begin at earlier ages. Those are women who have 2 family members with breast malignancy, a known genetic marker or genetic defect associated with increased breast malignancy, patients who've been treated with radiation to the chest for instance, Hodgkin's disease, and we will look at screening mammography at an earlier age in those people. In the public at large, it is age 40, and it is a yearly examination, and again combined with a professional breast examination.
Okay. And the breast self-examinations. I know there's been questions related to that in regards to, is it necessary? Is it effective? Should women still do that?
I have this question asked of women. I have been asked by women regarding their self-examination for years because everyone says, well, they're lumpy bumpy, I don't know what I'm feeling. And my answer is, what is your baseline? And your baseline and what is normal for you is important, because if there is a change, it may herald the onset of an early malignancy. I've had women during my practice years who will say, this is different. And I'll feel it and I'll say, it's not particularly suspicious. And they say, no, it's a change. And I have biopsied and diagnosed malignancy based on their finding alone. So the appearance of the breast, the appearance of the nipple, the presence of discharge, the appearance or change, or I've had a young woman who just felt a different twinge, and we pursued it with imaging and diagnostic endeavors and found a very early cancer that it was at its curative stage. So breast self-examination is extremely important.
And from what you said, doing it early, not waiting until later in life, but to do it early so they can understand what their baseline is, as you put it?
I'm often asked about the young woman at age, and I say at age 25, 30, if you get a sense of what your baseline breast is in the average risk, and do your self-examination and get in the habit. One thing that we're seeing is cancers arising in organ systems at earlier ages. And so it's best to begin being familiar with yourself at an early age. I tell my patients that while we know every new rattle in our car and we go and take it in right away for diagnosis, we have changes in our body, we feel them, we notice them, and we do nothing about them. And those may be the very first signs that you're developing some disease, not necessarily cancer, maybe an inflammatory process, but there's something wrong, and so you should pay attention and see your physician.
Okay, great advice. Good, thank you. And so what happens if a woman does a self-exam and finds something suspicious or something of concern? What's the next step? What should they do?
We always ask that they start with their primary care physician. However, if there's difficulty in access to the primary care physician, busy, can't get through on the phone isn't answered or calls returned, because it is an imperfect system and a system in which every office is quite busy, we have Dawn in the breast center as a secondary resource. And you may contact Dawn, who will then get busy and get together with that primary care provider's office, get an order for the mammography to start the evaluation, get an appointment, facilitate their evaluation. She may even perform a breast examination to confirm or perhaps allay the patient's anxiety during the time when we're evaluating.
Okay, great. Good. Well, that sounds like a great service. So, well, thank you. I want to, I know you've mentioned a 3D technology, and I know we're going to take a little bit a different direction, talk to Dr. Suslavich now and talk about that technology, which we're really excited to show. And so thank you again, both for your time and for the good work that you do.
Thank you, David.
Thank you, David.
Hi. Now we're joined by Dr. Frank Suslavich and Colleen Mikic. We're in the mammography room, again, at Fairview Range Medical Center. And we're, again, really excited to show you the new technology, 3D mammography. And Dr. Suslavich, help us understand exactly what that is and why is it so special?
Well, what it is that this is the most technologically advanced mammogram machine in the world. And the Fairview Range Hospital really went out of their way to obtain this equipment before anybody else in northern Minnesota has it. It makes this the best place in northern Minnesota to have a mammogram, simply because we now have the technology to identify cancers at a much earlier stage. Now the question in everybody's mind is, well, does it take any longer? Is there any more radiation? And the answer is no. The amount of radiation is exactly the same as a normal mammogram, and the amount of time that it takes is exactly the same. And Colleen's going to show you how fast this actually really happens. So we have on our machine now an apple to act as our test for this procedure, but we're going to actually take an actual picture of that apple, and you'll see how quickly this actually happens. What you'll look for is you'll see the machine as it sweeps by this apple and moves from one side to the other. It'll actually be taking 15 individual pictures of that apple, and with those pictures we'll be able to slice that apple as if it was a loaf of bread and pick out each individual slice from that loaf and look in that slice. And I'll show you those pictures in a few minutes. But for right now, I just want you to see how quickly this happens, how there's no additional radiation, and how it's no more uncomfortable than a normal mammogram. So Colleen, if you will. As you can see now, the scanner is starting to move, and as it goes along, it's taking 15 individual slices of the breast and allow us to look and see little tiny cancers that we could never see before in a detail that's never been available before. This is something very, very exciting. Suddenly we have the ability to detect 30% more cancers than we could ever detect before. And this will make a huge effect not only in in finding the cancers, but in terms of the survival, because we will be finding these cancers at a much earlier stage when they're much more easily treated. So we're going to take you now from this room and show you the pictures that we'll be looking at when you have your mammogram here at the Hibbing Hospital.
Excellent.
We just moved over to view the images that we just took of that apple. And what this machine allows us to do is we're looking into the core of the apple, seeing the individual apple seeds. And as we step through with each step, we can see the individual seeds and actually see within the seeds in the core of the apple. So we see a seed here, we take a few more slices, we see another seed here. And although this is just an apple, it really gets you an idea of the detail that we can now look into the breast and find the cancers that we could never find before. Now, what makes this machine so special is that in a national study of more than 500,000 people, that there were 30% more cancers found using this technique than using conventional mammograms. And these people were tested at some of the most advanced academic centers in America, and at every center, more cancers were found using this technique than using conventional mammography. Every single radiologist found more cancers using this technique than using the conventional technique. So it was rushed into being released by the FDA just because it made such a difference. It is such a landmark change in mammography. And we're very lucky here at this hospital that the Fairview Range Hospital invested the money to make this available to the people in this community. This hospital has done that time in and time out. We have the most advanced CT scanner in the northern part of the state. No other hospital has this, and we are the first to have this very impressive breast technology here at this hospital. No other hospital has this available north of the Twin Cities. So this is something very, very special, and it really is going to have a very positive impact on finding cancers at their very earliest stages. And although we've only been using it here for a little over a week, we've already found 2 cancers that we wouldn't have found any other way. I'm going to show you an example. This is a test mammogram that was sent to us by the company, but it demonstrates the point is that here's a conventional mammogram. And you can see that when we take a picture, everything in 3 dimensions is squeezed down into 2 dimensions. So things in the front, things in the back are all squeezed together and they're all overlapped. And you can see how we see all this density, but it's hard to look into it and find a cancer. And the machine, by taking 15 individual slices, we can go into those slices and we can see. We think about cancer in the astrology, cancer is a crab. Well, cancers grow like a crab. They extend out, and you can see how they reach out into the tissues. And on this mammogram, we really can't see that. When we go to the individual slice, we can now see this little cancer that we could never see before. I mean, this is very powerful technology. We are seeing things that we never could before. And the best things for patients are, first, they've had no more radiation. It's taken no longer than a normal mammogram, but now we find 30% more cancers. And many women over the years have had the experience of they've had a mammogram and then they get called back for additional mammographic views. By having 15 individual slices, we significantly decrease the number of times that women have to have additional mammograms. So in some ways, we're actually probably saving radiation that women would have otherwise gotten. In the national study, there was about 15 to 20% less callbacks for that, for additional views on the mammogram. And I think all of us recognize that when women are called back, it's a moment of anxiety. Even if everything is okay, there's suddenly that worry. The nice thing about the breast center here at the Hibbing Hospital is not only are we going to have less callbacks, but we talk to the patients while they're still here and give them the results. in virtually every other place in northern Minnesota, people get reports 2, 3, 4 days later. Here, when you come to the breast center, you get your answer the same day you have your mammogram. So you come in, you have your mammogram, and the technologist tells you that everything is okay. I mean, in terms of anxiety, that's really powerful. Every minute that you're waiting, everybody's always worried. What's in the mammogram? What did they find? Did they find anything? We take that anxiety out. And that's an incredible service to the people of Hibbing and the surrounding communities. This is something very, very special. We're finding more cancers earlier, and we're able to tell you at the same time that you're here that everything is okay. And that gives you an incredible amount of peace of mind.
Well, that's our show for this month. I hope you enjoyed it. It was really exciting to learn about all the new technology. And the 3D mammography is really exciting. And I think we're really excited and pleased for the patients that we serve. And we know it's going to make a huge difference. So my thanks to Dr. Frank Suslavich, radiologist, Dr. Sandra Hanson, who was a general surgeon here, Don Hayes, our nurse navigator, and Colleen Mikich for their help in our filming today. Thanks for watching. I hope you enjoyed it, and watch next month for another segment of Fairview Range Focus.
Hibbing Public Access Television would like to thank U.S. Bank for providing us with studio space.